Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
When you get the diagnosis, there's a sense of relief of, oh my God, I have a name. Now I have to do something different. And what is that different going to be? Because it's completely unknown.
Welcome to Let's Get Personal, a podcast that shares the rheumatoid arthritis treatment journey. Hi, I'm Dr. Daniel Hernandez from the nonprofit Global Healthy Living Foundation. Through my work, I have the opportunity to speak to many inspiring people living with rheumatoid arthritis, and we wanted to share some of their stories with you. So, welcome to our podcast where we'll chat with people within our community about their experiences and hopefully through their stories, inspire you in one way or another. In this episode, we'll hear from Dr. Grace Wright, a superstar rheumatologist and advocate for patients' rights. Dr. Wright has been treating people with all types of rheumatic conditions for years and gives us insight on the point of view of a rheumatologist. She gives us tips on how to improve your relationship with your doctor and even how to speak to your doctor about getting a second opinion. Let's start. Thank you so much for being here with us.
My pleasure.
I'm really interested in hearing your thoughts on precision and personalized medicine. As you know, this is a tool set that drives towards the approach of the right treatment for each individual patient that can be done in the clinic. So could you tell me how these two concepts play out in your practice?
This is a really critical issue, and different people use different language to describe this. I mean, for me, this is sort of the core of how I practice, but I know that there are wide practice ranges across the country, across the world. When I think about precision medicine, it's twofold. It's about taking the tools that we currently have available to make the right diagnosis. Because if I miss the diagnosis, then everything else is moot. So there's precision in the diagnosis and then precision in the care. And the precision there says, how can I choose the best therapy that allows this person to have the greatest chance of success and really sort of acknowledge that there are side effects, there are comorbidities, there are other diseases that may come into the picture that I have to also think about and manage, and choose the one that's ultimately best for them. Personalization is even one step further. It says for the person in the room in front of me in their particular circumstance. So do they have young kids at home? Are they a school teacher where they're always around 4-year-olds with, runny noses? Or are they a farm worker who has sort of long hours and heavy labor? Are they sitting at a desk all the time? Do they have access to certain things that some other groups may take for granted? So it's personalizing the care so that that person has the best chance at success and really sort of providing a level of equity. So it really is an even more nuanced approach. And then it also says, what does that person prefer? Are they really not keen on having a medicine that they have to inject themselves every day, every week, every month? Or would they prefer a pill, or is an infusion actually the best thing for them? So personalization takes into account that individual's choice, whereas precision takes into account the disease's perspective. And it's really bringing those two together that allows me to have a conversation that allows that person to make a decision.
If a person previously diagnosed with RA is not feeling like their medications are working properly, but is hesitant to speak to their rheumatologist about this because the labs are coming back fine, what is your advice on how a patient can broach this conversation with their doctor and possibly change treatment plans?
Yeah, that's really so key because, we're all trained to look at joints and are they swollen and tender? Is the blood work normal? Does a person sort of look normal? And then I say, okay, so your RA is controlled. However, you can't sleep. You're so fatigued, you can't get out of bed in the morning, and you're achy even though things look normal. So I always say, never come into the office just saying, I don't feel well. That's valid, but it's too non-specific. So what I love to hear is, what are the things that make you say you don't feel well? Are you so tired you can't get out of bed in the morning? Are you crashing by 4 o'clock in the afternoon? Is your medication making you so nauseous that you're probably skipping a couple of doses here and there? And even though your joints may look normal, are they so stiff that you're having trouble in the morning getting dressed and functioning? So it's the detail, and it's easiest to remember that when you're not under pressure. So when you're not in the office. So come in with a list just so that it keeps you focused and we don't have this sort of just large sort of roaming discussion that might miss some of the key things that are important for you. So I'm a huge fan of people. I have my patients, make a list. We may not get through all 30 items, so give me your top 5 so we can really focus on that so that I understand what you're living because all I have is what I see on the day that you show up. And 3 days before, 3 days after, it may feel really different. And so that's always important. If you happen to have a device that can take a picture, take a picture. Maybe your joints were swollen and I didn't capture it that day. You had a bad ulcer in the mouth from one of the medications that we gave. Take a picture and show it so that I can really sort of understand what you're feeling. I always tell my patients to give me an idea of the experience that they're living, not just the data points that we check off when we do our disease activity assessments. So, yeah, lists are great, but thinking through why I don't feel well, that's even better.
This brings us to the next question, which we've also been hearing a lot about, which is the wait and see period, this latency period, that period after you begin a new treatment and have to wait a few weeks to see if it's working or not. What should a patient be doing, paying attention to during this time? And also, when should they reach out to the rheumatologist during this wait and see period?
Wait and see periods can be some of the most frustrating times in life, right? Because you don't know how long to wait or what you're expecting. So for me, I dial it back and say, at the point in time that a decision is made to do X, ask, when should I expect to see something? Is this because of my RA or is there something else that I need to do? Because sometimes it's not about changing treatment, it's about changing diet, working on sleep habits, trying to reduce whatever stressors there are and then find out, does this drug take 3 weeks, 3 months, 6 months to work? And can I actually accommodate that? Do I need to be able to get up and go to work next week? I don't have 3 months to wait because then maybe the decisions and the choices that are made for you or with you can be changed. So I think it's really important to do that. And once you set expectations, then it's much easier to manage sort of that fear of what is coming, what is not coming, the frustration of not having an immediate response. I like to say to patients, I can't fix this overnight, but here's the plan. We're going to first do this. And if we see this, then we're going to do that because now they have a roadmap. And if your physician doesn't do that or your healthcare provider doesn't do that, then ask them for the roadmap. Many of our drugs, unfortunately, we don't have lots of predictive things to say, this is definitely the one for you. We all think it and feel it, but we're really hoping and wishing, right? And so we're also setting expectations for ourselves. And that's a discussion that's really easy to say. I'm not sure. This really looks like the best and the safest one for you. And I expect to see something over the course of the next 4 to 6 weeks. But ask for that.
Dr. Wright also had advice on what you can do during this wait and see period. She talks about paying attention to your symptoms and doing the work of wellness.
I say, it's really important that both the provider and the patient participate together in doing what I call the work of wellness. So don't become frustrated and, just sort of give up hope. Do the work of exercise, working on sleep, taking your meds appropriately. If you're having a side effect that is not great for you, some people don't mind nausea. Very few people I know will sort of dismiss nausea. But if you're having a lot of nausea, if you're throwing up, if your skin is burning, let the doctor know so that you're not waiting for the 3 or 6 month visit to then know, oh, I didn't have to suffer all along. There's also being aware of what's happening and what's working and sort of what you can tolerate based on your life, and then contacting the office or resetting your expectations yourself.
I think this is a masterclass not only for patients on how they should be interacting with their physicians, but also for physicians on how they should be interacting with their patients.
Yeah, I look at this, I say these are relationships. This is a person who is feeling unwell and a person who's trying to help them feel well. It's a relationship. It's like two kids meeting in the sandbox for the first time. And we have to take care of each other's emotions. And so sometimes when a provider is really doing their best and they themselves are frustrated because they're not making you better fast enough, It may seem that they don't care. For the most part, rheumatologists really care for their patients. So really just explore it from that angle. I know you really care for me, but this is not working for me because, and that sometimes really just sort of takes all of the tempers down. But it is also very important. I speak about this all the time about finding your voice and having your voice heard. So never be afraid to speak up because this is the person with the degree and I'm just the patient. No, you're the person living in the experience. I'm here to serve you. So really always, even if it's to the nurse, the medical assistant, the front office staff, start wherever you think you can and then work your way upwards, but never ever give up your voice because it's the only way that we on this side will know exactly what's happening to you. So there's no right or wrong way to do this. Some people write little notes, they send a little thank you card and put a little thing in there that says, oh, by the way, I need to talk to you some more at the next time, right? Sort of, it's about working out that relationship. These are diseases that don't disappear overnight. So 5 years, 10 years, 15 years later, even if things are under control, you're going to be checking in with this person. So always manage this from how do I keep a long-term relationship, right? How can we work on the same side and not be adversaries, but still watch out for each other's needs? And I think that, as humans, we all appreciate that. And it just helps to move that needle along so that you can speak and I can effectively listen.
We've heard about this duality of emotions from others, the feelings of unknown slash fear, but also of excitement of potentially feeling better than right now. What's your advice for your patients managing this seesaw of emotions?
It's a roller coaster of emotions, right? And sometimes it's a roller coaster of symptoms to add to that. So it's this duality that you have. Your head is doing one thing, your heart another, and your body is completely in a third space. And yes, you're right. When you get the diagnosis, there's a sense of relief of, oh my God, I have a name. There's a title to what I have. I'm not crazy. I'm not making this up. And then it's like, oh my God, I have a diagnosis. Now I have to do something different. And what is that different going to be? Because it's completely unknown. And I think the first thing is just to acknowledge that both of those emotions are okay. It's okay to be excited that there's a title, and it's okay to be in dread that your life has just changed because your life has just changed. And many times I find that we try to minimize one or the other, and there's no need for that. Uh, Experience both, accept both, and then it's about taking the first next step to say that, okay, this is where I am. I'm really sort of completely panicked about this. Let me get information. Let me talk to somebody. Let me get a support group, find other people like me who have walked this path so that we can hold our hands together. And it's because we've accepted that. And also to share that with your healthcare provider, whether it's a clinical nurse specialist, a nurse practitioner, physician, so it doesn't really matter. The other person on that other side, share that with them because when you walk in and I look at you, I go, oh, he looks okay. He doesn't look afraid. And you're actually shaking in your boots on the inside. I can't help you with that emotion. And sometimes you really just need somebody to say, it's okay to be afraid. Here's how we're going to handle that. So, yeah, accept the fact that it will be highs and lows. And, when you have to then change your medicine, it's highs and lows again. Oh, there's a drug that can help me that's better than the one I had before. Oh my God, I have to change my drugs. That's part of the journey. That's why it's not a you walk in, you're cured, and you walk out. This is not a sneeze or a cough, right? This is something that we're going to have this waveform going through. Then to really stick with the plan. If there's an issue where I'm too depressed to exercise, well, then let's talk about the depression. Let's talk about the fact that I have no place to go to exercise. Let's find a solution. And for me, that's what I call the work of wellness. It's you doing your part as a patient to help the plan along, and me then working to support you. And then the final piece of it is sort of this idea of maintaining hope, of understanding that the moment you despair and say it's all over, something within you just quits, and that quitting is a thing that is going to drive you away from doing the work of wellness. So if you're feeling hopeless and you're feeling desperate, talk to somebody about it.
Persistence is defined as continuing firmly or obstinately in a course of action. And
all of this in spite of difficulty or opposition. Chronic illness, such as rheumatoid arthritis, has been described by patients as a persistent journey to everything that we've been speaking about. Being persistent seems to be key. Could you talk to us a little bit more about this persistent journey? I know that there's going to be highs and lows, not only for a patient, but also for a physician that's treating this patient. How do you motivate yourself when things aren't going as easy as you thought with a patient?
Yeah, I mean, this is where I call the wellness fatigue, right? Because patients will look at me and say, "Do I have to do this for the rest of my life?" And that is the beginning of the acknowledgement of I have a lot of work to do and it's going to go on forever, and I have to persistently do this. My response to that always is the rest of your life is a very long time. Let's talk about the next 5 days, the next 5 weeks, the next 5 months. You have to put it in to compartments that you can manage because it allows you to persist for 5 months and then another six and then another 1 year. When we try to do this, I'm just going to start and I'm going to plunge through. Often we fail, right? Because it takes a lot of emotional and physical energy to do that. So, yes, it is a journey and it's something that you have to continuously work at. Every once in a while, things go really well and they stay really well for a period. And for many, that could be weeks, days, months. I've had patients in that state for years. But we never forget that there is this thing that could rear its ugly head because of some external thing. You had an infection, you had a stress, or something else happened. In this day and age, you got COVID. Something happens, and we can't control those uncontrollables. But that persistence is important. So part of what I think is important as a provider is to acknowledge that it's a lot of work for a person to continuously work at managing their health, managing their life, managing their jobs, managing their families, and not to demand so much of them that they have to be superhuman to accomplish all of this. To provide the support that says you're doing a really good job. I know it's really hard. Let's see if we can improve this one thing next time so that you're not fighting everything. You're just working on one thing. And we're going to do that for the next 4 weeks. So you get a bite-sized plan that you can manage and so that your persistence can continue. And then for the provider, just imagine that it also is an emotional toll on us taking care of patients who, have lots of demands that may be outside of the realm of traditional medicine. And so it's important for providers to maintain that sense of well-being because we have so, overwhelmed ourselves and not taken care of ourselves, not gotten the support that we need so that we can support our patients, right? So it's everybody in this system has to have some self-care and that's the only way that we both get through it. Because as we said before, this is a lifelong relationship. It's a lifelong journey.
And my last question. Sometimes it has to happen, which is the need to ask for that second opinion. Is there any advice that you could give patients to broach this subject with their physician? There's so many questions about it that I'd love your perspective on it.
Yeah, that's a tricky one, right? Because you first have to say, why do I want a second opinion? Is it because I don't trust this doctor? Is it because my next door neighbor's great grandniece who has a friend in another state, in another country, said, oh, there's this new drug and your doctor's not giving it to you? Is it because I don't trust the healthcare system in general? And so I just go from doctor to doctor to doctor. So that takes a lot of sort of awareness on that individual's part. And often, when this comes up, we're not so self aware to say, we understand why we have a query that we want to have validated elsewhere. And all of that aside, it is everybody's right to get another opinion if they are unsure. And sometimes that other opinion will say, your doctor's doing a great job. This is exactly what we should be doing. And you know what, you should stick with this. Or you'll hear, well, we have had many drugs that could have treated you. There are some other options that you might want to consider. And then you have the choice. Do I stick with my current doctor or do I go elsewhere? And the other part is when there's just a personality mismatch, and sometimes we don't have the luxury of choice because there is one physician or two providers in the area. And so you're sort of stuck and then you have to work out a bad relationship. But again, I come back to this is a relationship. if you can't communicate, if this person's not listening to you, if the staff is sort of so dismissive that you can never sort of have your voice heard, in view of understanding the work of wellness, it may be better for you to change. And so it's important to understand that about why you're in this situation so that you're shifting for the right reason. But it's always okay to get another opinion. The other thing that often comes up is, do you tell your doctor that you're getting another opinion? Are they going to feel that you're betraying them, that you're abandoning them? And there are multiple ways to do that nicely. To simply say, think of when you want to hire a plumber, you want to have somebody paint. You just simply say, that's really great. Let me think about it. I want to ask somebody else. And you can say to your doctor, I love what you've been doing, or I'm a little uncertain. Sometimes I'll hear the imaginary child says I should get another opinion. It doesn't matter. But just, it's okay to say, I want to just get another consultation so that I'm sure about what I'm doing or what the diagnosis is. We all do second opinions. We all have second opinions done on us. It's not, unheard of or uncommon. So never feel that, it's a betrayal of me. It's your right to do that. It's just about how you communicate that can either disrupt the relationship or have transitions be smooth.
That idea of a long-term relationship between patient and physician is so strong and so real. And we have to take care of each other, especially during these times of turmoil. So thank you, Dr. Wright. Please stay safe.
Thanks for having me. It was a pleasure being here.
And thank you, our listeners, for listening to Let's Get Personal, where you hear about the RA treatment journey. If you'd like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Daniel Hernandez, and we'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.